Hello, everybody. Welcome to Aware and Care. I'm Madhvi Bathula, a weekly medical program, Ayurvedic perspective to understand about our health and to take care of little situations that we handle on day-to-day basis. This is many a times, there's a saying, and I think every language, to see a beauty, two eyes aren't sufficient. You need more than two eyes to see something. Maybe it's the inner soul, and sometimes actually the physical eyes that we talk about. In the various programs that we've covered here and the various issues that we've covered about many aspects about the eye. Yet there are certain diseases and situations which need much more attention. Today, one of those concerns we will be addressing and be talking to Dr. Ambika Nair. As you know, she is the co-founder and chief consultant at Santhigram group of companies. Let's welcome her in this new episode in the new year. Welcome to 2021, Dr. Ambika Nair.
Thank you so much. Happy New Year to you all.
Thank you. And likewise, we're wishing everybody good health and safe times in the year ahead. And in case there's any problem, there's always Dr. Ambika Nair and, of course, the entire medical professionals across the world, which Dr. Nair always says, go and meet your doctor first before you try anything at home. Dr. Nair, I was just saying that the world is a beautiful place, and I'm not sure if it is applicable in your language, but in many languages, there is a saying which says that these two eyes are not sufficient to see the beauty outside. So as age progresses, we have covered topics that affect the eyes because of the age. There are also certain conditions which affect the sight that also we have covered. But there's a constant fear for everybody. That is about blindness. There is a possibility, some people say that it is because of heredity. Sometimes it happens because of high blood pressure, thyroid. And there is a particular terminology used for that. We would want you to address that aspect today. And what is that called?
It is called glaucoma.
Glaucoma. Yes, it is glaucoma. Yeah. But in this episode today, my friends, if you have any questions regarding this particular condition or otherwise, feel free to text and comment during the show. Dr. Ambika Nair will address that. So, Doctor, we were going to talk about glaucoma today. So, I gave a brief layman's understanding or fear that I have. So, how would you describe what this condition is first?
Yeah, it's actually glaucoma. It's more often seen in people, like by the age of 60. It happens like that. Okay. And it's a sight-threatening because you don't know whether you are already getting damaged, your eyes. How it happens because there is, like the fluid builds up in the front part of your eye. So extra fluid increases the pressure of your eye. So your intraocular pressure increases, thus damaging, corroding your optic nerve actually. So when it corrodes means because slowly you can see that, the first symptom, so many people will tell while driving, they cannot drive because the opposite side of that vehicle, how it comes, because it air holes they can see a circle around that.
Oh.
Okay. So that, even on the lights, they cannot see because so many people will tell. So it can happen not only by 60, even, youngsters also even 45 or even 50, if they have any high blood pressure, arthritis, I have seen and even asthma people, I have seen a lot of cases like that. So they will tell.
So one second, doctor. I just wanted to just get that information again, once again, to our viewers that glaucoma is not only a condition which will affect senior citizens, but it can start at any age. Is that what you're saying? Even children are affected by this?
Even congenital glaucoma is there. In certain, in the family, because children are born with the congenital glaucoma.
Okay.
Okay, so there will be some blockage, then we'll come to that. Okay, so, so the patient, some people will have little pain sometimes. They say that if some...
Pain in the vision or any part of the
eye sometimes, if they look for some time, more. So these things, so air holes are mostly what they will tell that because they feel like that. If it is if it is primary type, that is, an open angular, glaucoma. So that is the common type what we get it. It is painless, but it causes vision changes. It will not cause any vision changes in the first stage. But later only, vision changes comes. That's why people go unnoticed. They will tell that they are doing, because if it does not come in both the eyes together. Sometimes in one eye, so the other eye will pop up. So people, they will, once when they get the pressure, they have little headaches or anything like that. Then only they will tell that we will go to the doctor and they will tell that, your intraocular pressure is very high. You are diagnosed with the glaucoma. But what type of glaucoma, that is more important actually. Whether it is type 1, whether it is, like a type 2, that we call it as angle closure. Okay, that is with obstruction. So, like you see some mechanical causes, if you fell down somewhere, any accident is there, some damage has come, some blood clot can get into the, like where and block the drainage angle. Even the iris, from anywhere, if it is near to that angle also, it can happen like that. If sometimes some dust particles, people will tell, I was working in that area, so much dust was there. Suddenly, like something has gone inside my eyes and I felt like vomiting. So these are all medical emergencies actually. Okay. So they will, like a sudden blur vision, severe eye pain, headache, nausea, abdominal pain, even sometimes fainting can also happen with them. Okay, and this is all because of the, blockage over there. So at that time, they should really go to the doctor, and they will do sometimes, minor surgeries are done, lesser surgeries are done. But people ask, how you find out whether you have this glaucoma? You should go to the eye specialist.
So that was my question that was coming up. So does this condition always come up, can also be diagnosed during vision test?
Why not?
It can. Okay.
When they check the pressure, they will see that whether you have any, if your intraocular pressure is high only, they will tell that, then the root cause, that there are so many other, diseases also along with that. But we have to see that.
Yeah, what you said is very right. See, because a patient or a person with discomfort has to always tell that to the doctor. So if you just go for a vision test and do not mention these little symptoms that are there for a certain time, the doctor themselves would not be able to understand and give you the right medicines or the prognosis for this situation.
No.
You also mentioned in the beginning of the program that this is not a life-threatening, but it is a sight-threatening problem.
Yes.
But when you mentioned that when people are driving, they see a circle, they not see the light and all gets affected. So it can at some point become life-threatening also, especially if you're driving and driving at night. It is of concern. So during vision tests, it's possible that it can be diagnosed, but a patient must always share all his discomforts and problems with the doctor.
History has to be. The doctor will take the history and they will ask the questions. That whether there are certain questions also in that. Like they will answer it if they answer properly, but they should get it rectified, right? Yeah.
What is the common fear people have when they go for a vision test that they do not want to share the complete information? You must have seen in your experience that your patient has come back in the second and third visit and has not mentioned certain family history or certain symptoms, but he has expressed that in the third or fourth visit. What is the major fear? Why do patients usually not share the complete information sometimes?
No, that is lack of confidence.
Okay.
Confidence in the doctor. But for me, they will tell everything on the first instance itself.
That is very important.
Okay,
so that's what all about.
That is very nice. Actually, they are very good, and because I like to take care of them, and no complaints.
No complaints. So, doctor, we were just talking about the history about as to how and why this particular problem comes. It could also be a genetic or hereditary factor, which is there a history of family factors. Are there any health conditions that lead to this situation, like high blood pressure or thyroid or anything else?
Mostly diabetic people, blood pressure, asthmatic, and sometimes neurological disorders, major accidents.
So there is a myth that about this particular condition. I really want to get it out open there. After a long time, I'm asking this question. Is it a curable condition or manageable condition?
It is a very good manageable condition. If you really take care, if you go to the Ayurvedic doctor, they will 100% take care of these things. Okay. And you have to manage. So doctor will take care of that. Management has to be done by the patient itself.
And what factors, outside factors, affect the sight, doctor, when a diagnosis is done and we come to know that the patient has glaucoma? What are the first few things that you tell the patient to avoid doing?
No, according to the Ayurvedic perspective, what we see, that why he got it. Okay, according to the constitution, we will see that which prakriti is 90%, is kapha related, because the mucus comes and blocks over there. So that's what I told, because asthma people, sometimes with allergy, some very chronic sinusitis. Some people has past sinusitis, so many like other issues. So, then we will do, the treatment will be given accordingly. And diet is also given, what they should eat, and what exercise they should do, what yoga they should do, what yoga they should not do, which will help them so that they will be able to maintain without a vision loss.
Okay. So those are very interesting factors, and also we do a lot of screen time at this point of time. And is it possible to continue all those regular activities during the course of the treatment? Because vision is a very important aspect, whether you're driving or whether you're typing something or reading something.
No, vision activity, because nowadays we cannot tell them not to do all those things unless it is very, very severe case. You understand now? So at that time, what we will tell them, maybe they can decrease their hours of vision, screen time and all. But normally, because my patients, I'm telling you, my people who come to me for the therapies, we don't disturb like that, and they are doing very well. Even if you want, we can get so many testimonials. That much, because they are so thankful, they are so grateful to us. Because what we did to them, because their doctor was also amazed that their, pressure has come down, you are maintaining a very good thing. It's like, anyway, that is their luck too. I won't say that we are above God.
Discipline is very important when a treatment is happening, and I think the complete cooperation of the patient is a must. Dr. Nair, please let us know that this condition, does it start with both the eyes or one eye, or gradually progresses into the other, or they are independent in both the eyes?
No, normally it starts with the one eye, then it comes to both the eyes actually. But
okay,
for some people it starts both eyes also.
Okay. In the starting, you did mention that when one eye is affected, the pressure is more on the second eye. So during the course of the treatment, or a person who has glaucoma in one eye, what protection and other factors he or she should be doing to save the other eye from getting this?
No, that is actually a tricky question. See, what we do, when we do the treatment itself, because they cover it, so that care is given actually. Protection has to be, because I told you the root cause has to be taken care. Whether it is with the nausea, whether it is with the stress also, it can happen. If some people, they don't sleep, their sleep is very bad. So, like a neurological disorder. So we give Sirodhara, Netradhara, Netratarpanam. There are so many treatments in that. So that once we do means, we will send them to their own doctor, eye specialist. They will go to their doctor and they will tell that, okay, now how much you are doing better. So, because I will not tell them that I have taken care of both your eyes. I won't tell anything. We will do the treatment so sincerely. So they will go and they will come back and tell that, okay, oh, now my pressure is like this and I am doing much better now.
Dr. Nair, we also see a question coming up. Somebody is asking, is it completely different from cataract, or cataract can also lead to glaucoma?
Cataract can also cause glaucoma actually.
It can.
Yeah.
Can you give us more information on that?
Yeah, because actually, pressure can, because eye disease is blockage, blockage will be there, means naturally it will come.
And is there any surgical intervention required to cure the situation in worst case?
Yeah, if it is obstructed.
Okay.
So otherwise they will lose the eyesight actually then and there. If it is obstructed only, then and there they will go. Otherwise they will give them some eye drops and all. In Ayurveda also there are so many things what we do for them, and their diet also. Then they improve like anything, and they are managing without getting their eyesight lost. So their vision is restored by Ayurveda, I should say that actually.
So, friends, this is a sight-threatening problem, a condition which can be managed if you go to the right approach. And especially today, we are talking about Ayurvedic perspective of treating glaucoma, and Santhigram group of companies and Dr. Ambika Nair's entire team is here. Always have this conversation. Always take a second opinion. Get multiple visits, talk to the doctor, and take it into confidence and share all your discomforts, because that is the only faster way to get the treatment done. Dr. Nair, also let us know what kind of eye exercises are recommended during the treatment.
Eye exercises, what we do, we don't tell them to do a lot of straining, like reading and all. and a Shirshasana. So these things they should not do. And anything, no up, like a downward postage, like anything like that, that will increase the intraocular pressure.
So you're saying something to do with the head movement going down. That
should be down, that we will not allow them to do it actually. Because that is opposite actually. Okay, then like we tell them to stay calm. Let's say how much their vata is there, how much their pitta. That diagnosis has to be done, and we'll see that how I can help them.
And do you recommend them?
Pranayam, pranayam, mild exercises only. Okay, and anilom bilom. Okay, and such things only, but not very high exercises.
Not very extensive exercises, but the moment you said that, your head movement should not be towards facing down, so it should be on the stable level, so that itself shows that a lot of phones and laptops should be avoided at that point. What about driving? During the treatment, can they continue to drive, or you would say that they should take a couple of weeks?
They can drive. They can drive.
And
some people will come with, whatever you told one point that, dizziness. They will come and tell that when I look at the paper, when I read something, I feel dizziness. So this also, but sometimes it can be because of cervical. Sometimes some imbalance in the ear also can cause this. So, but we have to find out what is the real cause.
So there is a possibility that these conditions are all interrelated, or it could be leading to that. But the biggest problem here is sight threatening, that you don't want to gradually lose your sight. And that is what it is, to just curb it in between. Doctor, do you see that most people with glaucoma also have migraine or headache or sinus problems?
Sinus is very common, but migraine is also, that's what I tell neurologically. Okay, so migraine also people come with that. But not that every time they must have had migraine when they were young. Okay, not now. Okay, so that we take care.
Okay, now coming to another aspect of this entire treatment and understanding, there could be many a times the patient is already wearing spectacles, or he has a vision correcting device. And during glaucoma, do you see that his vision, as its vision is getting better, should they be constantly going for their regular vision test to see and adjust their spectacle numbers or vision numbers?
Very, very good question. Actually, because I tell my clients what they should do. They have their appointments after 3 weeks, after 4 weeks, like that. So when they go and check the vision, they will tell that. First, maybe like after 1 week, and they will tell that no, not improved. Okay, I told you 1 week is too early. Okay, then when they will go, they will tell that there is a lot of improvement in that. Like their vision, they themselves will tell that how I can see the light now. But they are not having any blurred vision now. So no need to go to the doctor at that time to identify that, because the person will identify it. They will
but they have to change the spectacles, right? The vision,
no, that doctor will, they will not change the spectacles, but later only. After maybe like 3 months and all, they will change the spectacles actually. Yeah, not before that, because the doctor will see that whether it is, like stable or not.
This is a wonderful, wonderful way of finding out what's happening, and your body yourself will tell you that you're going on the right path and the treatment is happening. And any kind of effects or side effects, good effects that you have, also you should be communicating with your doctor. It is like any other treatment. Many a times we have been talking about it. I think the last episode also, which was very popular, many of our viewers did say that, oh, all the remedies that Dr. Nair is sharing is available at our home. So, and the question is, yes, it is available. So why are you not doing it? So because we want to consult and get the right advice. And there's so much of information out there on the internet. Please do not blindly follow, especially when it is a sight-threatening problem. Always consult the specialist. Dr. Nair, yes, we are into the COVID second phase, and different strains of this particular problem is coming into the world. We are still going to continue by taking our precautions of mask and getting ourselves tested. Your advice to our viewers who come for treatment at Santhigram?
You have to do the COVID test. Otherwise, we will be doing only virtual consultation. And no therapy will be given if you don't do the COVID test. And it has to be negative. Because there's a protocol and we have to follow that, because the health department is very, very, not only why health department, we have to be very strict with that, what we are doing. We are supposed to take care of the country, right? Not
Yes.
that damage the country.
This is a global problem, and I think which can be taken care of at individual level. And just like Dr. Nair has mentioned, that appointments are available. A COVID test is a must for the safety of the doctor, her entire team, and of course for the safety of your own family also. Dr. Nair, when a patient is coming to Santhigram, and or suppose he or she is taking a virtual appointment, are medicines delivered to them, or they can come to the clinic to pick it up?
They can come and pick it up.
There's no problem in that. Okay.
If it is virtual, otherwise then and there we give. But if any problem also, they will take care of them. And we ship it to so many people, because not only because it's all outstation patients are also there, no?
Right. Yeah.
All over the world.
This is wonderful. So friends, picking up your medicines, for that you don't need a COVID test. I'm sure one family member of yours can always go and pick it up for you, and especially when driving is a little restricted. Sometimes this can be taken care of. Everything is provided. Only thing that you have to do is call that number that you see on your screen, or send an email to Dr. Nair and her team, and they will be able to help you. The first help step comes from asking for help, and that is what this entire program is, to be aware of all the possibilities that are there in your neighborhood, and be aware of it and take care of your personal health. Dr. Nair, please let us know if there's anything that we missed in the glaucoma topic that we are picking today that you want to share with our viewers.
No, anyway, because if you see any colored ring around the eyes and all, because when you look at the light and all, please see that, because there is something abnormal in your vision. Please go to the doctor and find out what has gone wrong with you. Because early diagnosis, you will be saved. Absolutely. So you can, we can always treat for the root cause.
Mm-hmm. And what kind of foods do you recommend to take care of this problem, problem? The foods that can be inculcated in our daily habits.
Ragi is very good. Buckwheat is very good, because this is kapha related. Okay. Not too much of spice. And yogurt should be stopped. So little, it is, because actually if it is mucus related. Okay, so this is all depend upon, because don't say that because whatever I told, because it is according to the constitution of the person.
Constitution of the body.
So that is there. And turmeric can be used.
Yes, okay.
Turmeric is
and friends, once again, I just want to give a... Please continue. Sorry, I had turmeric's also there. Okay. That is so much of information that we have shared today here on Aware and Care regarding glaucoma. And once again, friends, when the home remedies are mentioned and shared by Dr. Ambika Nair, these are on general perspectives, but many a times those home remedies are based solely on your body's composition and constitution. That is the reason it is a must to visit the doctor and get the consultation and the advice. And many a times doctor sends you home with only home remedies there, but that is totally depending on your composition of your body. Thank you so much, Dr. Nair, for this beautiful episode with so much of information. And I'm sure that week after week, my Googling has come down because I look forward to these episodes to get more information directly from the source, and that is you. And I must congratulate you and your entire team for taking care of all your patients and following all the protocols COVID required, and seeing that most of the patients are coming back happy, comfortable, and recommending Dr. Nair to many of our other clients and patients also. Thank you so much once again for this episode.
Yeah, thank you so much. That anybody can take a Triphala 1 teaspoon with 1 glass of water at night. That will help you a lot.
Okay, great.
Okay.
Thank you so much.
Okay, thank you so much.